Hi, welcome. Thank you so much for opting in and choosing to hear more information about my top 6 ways to stop bladder leaking so that you can move and do the things that you want to do. You can get back into the gym, wear those cute workout pants and not just the black ones. I'm Dr. Nicole Laird. I own Hayes County Physical Therapy and Wellness. We're in San Marcos, Texas, but also can come see you virtually. We specialize in women's health, helping women navigate all of life's changes from preconception all the way through menopause. Today, we're gonna chat a little bit about ending bladder leaking. What are my top 6 tips? Tip number 1. Make sure that you are monitoring your bladder irritants. So things like caffeine, citrus, carbonated beverages, chocolate even, can lead to an increased urge or frequency of going to the bathroom. So just take inventory and notice when you're starting to experience your bladder leaking. Is it when you've consumed large amounts of caffeine without pairing it with your water? Is it when you were drinking a lot of liquids in a small amount of time? Just take notice, and that's my number 1 tip to end bladder leaking. Tip number 2, make sure you're drinking your water throughout the day. So like we said in tip number 1, if you're noticing that you are going to the bathroom or having leaking after you have had a lot of fluid all at once, taking sips of your water, your fluid throughout the day can be very helpful in decreasing that frequency, that urgency, and that need to rush to the bathroom and have some leaking on the way. Sometimes if you're having bladder leaking while you are jumping, running, laughing, coughing, after you've had a lot to drink, it could be related to the fact that your bladder's just overfull. So drinking your water throughout the day, drinking your fluids, spacing them out, and not having such a large volume in a very small amount of time allows your body some time to process and have a very regular bathroom schedule without the risk of leaking. So tip number 3 is to focus on breathing techniques and strengthening exercises for not only your pelvic floor, but also your core, your hips, your back, your spine. All of this is interrelated to how our pelvic floor muscles function. So one of the first things that we work on with all of our clients is breathing techniques. It helps calm the nervous system so we're not in a constant fight or flight, I have to rush to the bathroom, which can lead to some of the bladder leaking that we experience. But it also helps with getting the muscles in the core, the pelvic floor, and the hips to all work really well together. So try this with me. We're gonna take a big breath in, and what I want you to focus on is breathing here into the rib cage. We're gonna open up the rib cage like an umbrella, and then breathe out and think about zipping up from your pubic bone to your rib cage. Like you're trying to tilt your pelvis under without squeezing your booty muscles. So again, we breathe here into the rib cage, and breathe out, draw up and in. Notice my shoulders and my chest didn't rise up like this. It's breath into the rib cage, opens like an umbrella, and breathe out. That helps work on that movement of the pelvic floor, but also movement in the rib cage and the diaphragm. Tip number 4 is to create a regular bathroom break schedule. Typical bladder emptying is every 2 to 4 hours. So if you're going more often than that, it could be that we've trained the bladder to go when your bladder is not completely full. So we're not fully emptying the bladder. It could also be that you are consuming more of the bladder irritants that are irritating for you and your bladder. So they are leading to the body sensing that it needs to urinate more frequently. Every 2 to 4 hours is pretty typical. If you're going more frequently, start to train your body to get back to that 2 to 4 hour mark. And you can do this by, when you get the urge to go to the bathroom, stop, take a deep breath, maybe do a couple of heel raises or pelvic floor muscle contractions, and then calmly walk to the bathroom as that urge has passed. If you can start to separate out your bathroom breaks, you will notice that you will probably have less frequent trips, number one, but also decrease some of that leaking, especially if you're noticing it on the way to the bathroom because you're rushing. So tip number 5 is to avoid prolonged sitting, because that can contribute to tension in the muscles in the core, the pelvic floor, the low back, the hips. Our bodies are meant to move. And so scheduling regular movement breaks can be really helpful in making sure that our bladder and our bowels are moving appropriately. If you're constantly in a seated position, which I get it, a lot of us are working from home and at a desk, but try to take those nice movement breaks every hour or two. You have to get up to go to the bathroom every 2 to 4 hours anyway. So getting up, moving, getting the spine moving, getting the hips moving can make sure that those pelvic floor muscles are doing what they're supposed to be doing and going through their full range of motion. They're like any other muscle and tissue in the body. They need to move through a full range of motion. They fully relax and fully contract to do their jobs effectively and appropriately. My last tip number 6, is seek out support from a pelvic floor physical therapist. My team and I are here to help figure out what is leading to your bladder issues. If you're still having concerns, you've tried some of these tips, you've tried stretching and strengthening and breath, and you've been getting a little bit but still not 100%, let's chat. We offer free in-person, virtual, or phone consultations where we can chat. We call them discovery visits, so we can kind of discover what the next steps are for you. That may be a full evaluation, working with our team, or maybe you just need some additional tips and tricks to help you get back to feeling strong, confident, and in control of your body.